But the first thing I'd like to do is talk about the relationship that a child with exstrophy has with themselves. It may seem like a funny topic, but it's actually an important topic. It's an important topic, again, to all children with whether they have a problem medically or whether they have no apparent problems. Because self-esteem, body image, all of these kinds of issues are real issues that kids deal with, humans deal with through their childhood and adolescent development, right on into adulthood and sometimes throughout adulthood. So the relationship with the self is not easy, and it's more problematic by and large for kids with exstrophy, whether they're boys or whether they're girls, for a number of reasons. One of the reasons is the issue of incontinence, urinary incontinence, or if they have cloacal exstrophy, urinary and bowel incontinence. Control issues are a huge part of growing up and of developing, and they're a problem also, or they're an issue rather, lifelong. And the control issues we tend to look on as occurring at certain ages, roughly, so that urinary continence typically happens in children, say, between 2.5 and 3.5 years old, or maybe 2 to 4 years old, something along that line. Whereas children with exstrophy have problems with incontinence that are structural problems. They have nothing really to do with control because there's no possibility of control until they have some surgical approach to control the continence issues or the incontinence issues. Well, that sets up a problem because it is pretty natural, pretty typical of humans to look on their body functions as things that they control. There's always an element of involuntary aspect to, there's always an element of involuntariness in all of those functions. If we're knocked unconscious, they all go ahead and function all by themselves, and we have no control at all. So we learn how to control these involuntary functions, and we see that as stages or levels of development, even though they're sort of tricky, and how any of us navigates those can be sort of tricky. And therefore kids have problems with incontinence sometimes in school age years, even when they don't have exstrophy. Kids can have problems with bedwetting and a number of other issues. So these are important issues, and these are issues that as parents we have to deal with these with our kids, and if we have kids with exstrophy, it's a more obvious topic and kind of tends to jump out at us as adults. The kids mostly want to deny it and not talk about it because it increases their sense of stress and anxiety. Other aspects are body image. So the kids see themselves with scars, they see themselves with wearing some kind of pad or padding or padded situation to keep dry, and all of those, any abnormalities they have, makes them focus on body image, and dealing with body image is also not easy. And these again are issues that typical kids deal with all through their childhood and adolescent years, and many of us don't deal with them too well as we grow up. So it's not at all difficult to realize that kids with exstrophy may well have trouble dealing with body image issues. They're not any easier to deal with as parents for kids with exstrophy than they are with typical kids. The difference is that we're more aware of them because our kids deal with them. Our kids can talk about abnormalities or being different or trying to be secretive and not let their friends know anything about their condition. So looking at the issues of self-image, looking at the issues of body image, you can understand why this sense of self becomes very important in the children with exstrophy. The sense of self is very important in all humans. It's just that the kids with exstrophy are more aware of it. They may not look at it in quite that way. They wouldn't word it necessarily that way, but I think that's a useful way for we as adults to, for us as adults to look at it. How we can help kids to deal with that is going to be food, if you will, for another talk. It's going to take a little bit of time, and we can talk about those issues. Again, they're going to be age-based, but they're also going to be experience-based. So kids who have no real difficult experiences with their peers, for example, or in public or social situations, are probably going to come out of all of that as they grow up a little better than kids who get quote unquote discovered with a capital D. I drew that so I could read it, but you can't read it, but reverse it. And the discovery issue is a big part of how a child with exstrophy needs to deal with the self. So those.